Good morning, my name is Monique Peters. I'm a second year medical student at UHSA, and today I would like to perform a lower extremity examination on you. Is it okay if I proceed?
Yes. Expose the lower limbs as much as possible. Ensure the patient's comfort and preserve their dignity. Look for asymmetry both proximally and distally. Note any deformities. Look for wasting or hypertrophy. Also, look for fasciculation and involuntary movement. Sometimes fasciculation can be induced by flicking the skin over a wasted muscle.
Let your legs go floppy.
Now we are examining the tone of the lower limb. First, we rotate the legs by rolling it from side to side, then by briskly lifting the knee to a flexed position. In pathology, tone can be either increased or decreased, and there are varying patterns of increased tone such as spasticity or rigidity. Now we tell the patient to relax.
Relax your legs for me.
Test for clonus at the knee joint with the patient relaxed and the knee extended, with the thumb and forefinger sharply pushing the patella towards the foot. Clonus is a rhythmic series of contractions evoked by a sudden stretch of the muscle. A few beats of clonus is normal in healthy individuals. To elicit ankle clonus, support the patient's leg with both the knee and the ankle resting at 90 degrees. Briskly dorsiflex and invert the foot, sustaining the pressure. Next, we test the deep tendon reflexes in the lower limb, starting with the knee jerk reflex.
So, relax your legs over my arm and we'll test the reflex.
The patient should be relaxed and comfortable. Anxiety or pain can increase the response. For this reason, we test the reflexes after tone, but before power in the motor examination sequence. The knee jerk reflex tests the function of the L3 and L4 nerve roots, and then we compare both sides.
Clasp your hands, and when I say grasp, I want you to grasp them and not before.
Use the reinforcement whenever a reflex appears to be absent.
Grasp.
When testing the lower limb reflexes, ask the patient to interlock fingers and pull one hand against the other. Here we test the ankle reflex using the S1 nerve root, ensuring that we bend the knee at a 90-degree angle and use a reflex hammer by the ankle. We should always repeat on both sides. Next, we test the superficial reflex, that is, the plantar response. We can do so by running a blunt object along the lateral border of the sole of the foot towards the little toe.
I'm going to run a blunt object at the sole of your foot.
The normal response is flexion of the big toe or great toe and of the other toes as well. Ensure that we repeat this step with the other foot. Ensure that the patient is relaxed before checking all reflexes. Next, retest power systematically in the muscle groups of the lower limb.